everybody ready? Do you need a white? Anybody? Everybody's good to go. You need a white? Does that help? Good? Everybody good? Give me a thumbs up. You're good? Okay. Good morning, everyone. My name is Brian Todd. I'm the Public Information Officer for the Metro Public Health Department. We are going to have a press conference this morning, and it's going to involve the speakers here. This morning, Mayor John Cooper will lead us off. Dr. Jahangir, who is our Board of Health Chair, will follow the mayor. Dr. Michael Caldwell, who is our new Director of Health, will follow Dr. Jahangir, and then Dr. John Dunn, the epidemiologist with the Tennessee Department of Health, will follow Dr. Caldwell. Following that, we're going to open the floor for a couple of questions, and then we'll have people available for one-on-one interviews following that. The other two people that are here that won't be speaking at the podium but also will be available for questions. First is Chief Swan to give an update on tornado, and then Dr. Adrian Battle from Metro Public Schools will be available too to answer questions. So with that, I'll turn it over to Mayor Cooper.
Thank you, Brian. Thank you all very much for being here. We have a confirmed case of coronavirus COVID-19 in Davidson County, probably to no surprise. In a moment, Public Health will go into details about best practices for our monitoring and response to this. I've talked to the governor, and we're working closely with the state on this response. Now, this obviously comes at a time when Nashville wants and needs to give each other a big hug, deserves to give each other a big hug, and we still need to do that. Public Health will be talking about how we do that safely with the best practices to keep our community safe. Now, the community response requires us all to listen to our healthcare experts, to take common sense precautions to protect each other, and the Public Health Department will be going into that. And we are working closely with the CDC and the State Department of Health. Now, I want to turn this meeting over to Dr. Jahangir, our wonderful chair of our Public Health Department. But before I do that, a little bit about the response that's going on, the magnificent response that's going on to the tornado. And a couple of separate cautions. If volunteers would be sure to move their cars off of the streets to the side and let Public Works and NES go on to their work. Secondly, this is an incredible weekend of response. Next weekend will be too. And in fact, in a way, it'll be a bigger weekend of response once NES has gotten power restored, areas are secured, and the first loads of debris, which are on the sidewalks, have been moved from the curbside. So help us get ready for and stay ready to volunteer for next weekend, which will be an even bigger weekend of moving debris and getting our streets back into shape. I'm grateful to Public Works, which has 71 trucks and crews operating today, and then to NES, which has 230 crews out restoring power. There are still, unfortunately, 7,036 customers affected by NES, but you do have 230 crews working all today, and hopefully by tonight that'll be a very manageable number. Schools are going to be open tomorrow with power restored everywhere. But with that, I want to turn this over to Dr. Jahangir, and I'm grateful to the Public Health, our very professional Public Health Department, in organizing a response to the news of the coronavirus being confirmed in Davidson County today. Thank you.
Thank you, Mayor Cooper. As chair of the Metropolitan Board of Health, my advice to the community is simple: stay calm. Having our first case is no surprise. For the past several weeks, we've seen this virus spread through other countries, through other states, and through other cities. The department has been planning for exactly this moment for the past several weeks. And in fact, earlier last week, I was briefed on the coronavirus plan. I have every confidence in the Metropolitan Public Health Department, as well as the Tennessee Department of Health, that that plan will be executed successfully. Now, clearly, Nashville is hurting right now with the damage from the storm last week. And the last thing we need to do is have unwarranted anxiety around this virus. Now, that's not to say that we should just ignore it. And in fact, we should actually take all reasonable precautions. In just a few minutes, health officials will give you the exact details of what we know about this specific case. And they will also go into what you need to do now to stay vigilant against the coronavirus. Now, I think this past week, we have seen that our community is strong. And I know that that strength is what will get us through this together. I now will turn over to Dr. Michael Caldwell, who is the incoming chair of the Department of Health for Nashville. Thank you.
Thank you, Mayor Cooper, Dr. Jahangir, Tennessee Department of Health, and other partners at Metro government. The Metro Public Health Department was informed by the Tennessee Department of Health of our first presumptive case here in Nashville. As Chairman Jahangir said, this has been expected. The presumptive case is an adult female. She is a Nashville resident. She has mild illness, and she's now self-isolated at home. Her illness is not considered travel-related. The news about our first case has seemed inevitable. Our guidance for the community remains the same. Everyone can do their part to help by remaining informed and continuing to take routine precautions. CDC.gov has excellent information. We have distilled a lot of that information down for us here in Nashville at health.nashville.gov. The best ways to prevent the spread of this respiratory illness, now called COVID-19, are to wash your hands often with soap and water for at least 20 seconds. We have demonstrated here those places where you could wash your hands, and at the conclusion, I'll be giving a demonstration to show you how to properly wash your hands, and I hope you'll join me so that I can make sure each of you are washing your hands as appropriate. As a second choice, and you'll see beyond washing your hands with soap and water, we have the hand sanitizer. Now, do your best to avoid touching your face, eyes, nose, and mouth. It is very, very difficult, but try to do your best and remind those around you, if you notice, to help them. Avoid close contact with those who are sick. And if you are sick, if you are not feeling well, please don't put yourself out around others. We are especially concerned about those people who are over age 60 at this time, and those who may have underlying chronic medical conditions. Cover your cough, if you have a cough, or sneeze with a tissue, and immediately throw that tissue away in the trash. I'm also mindful that allergy season is going to be upon us as well. So we have to be mindful about how people are presenting their symptoms, and also if people are having fever and other severe respiratory symptoms. Now, it's important that you try to clean and disinfect frequently touched objects and surfaces as much as you possibly can. I ask the community to now practice alternatives to find ways to greet each other instead of shaking hands. You've often seen now the elbow bumps that we're trying to do. I can tell you that we're going to be providing you more information on this in the days ahead about interesting ways that we may in Nashville try to greet each other. We are working to identify people who may have had close contact with this presumptive case. Close contacts would be anyone who may they live with or work with or have gone to seek clinical care. The details are emerging, and we wanted to provide you the information as soon as we had it. So all the details are not filled in just yet, but we will provide those to you moving forward. We continue to follow guidance from the Centers for Disease Control as well as the Tennessee Department of Health to ensure that appropriate protocols are followed. The Department of Public Health in Nashville and the Tennessee Department of Public Health are in the early stages still of this investigation, and these new details will emerge, and we will provide them to you. It's my pleasure now to introduce you to our Tennessee State Department of Health epidemiologist, Dr. John Dunn.
Thank you, Dr. Caldwell. Well, good morning. And first, on behalf of TDH, the Tennessee Department of Health, I want to thank our regional, county, and metropolitan health department partners across the state for the work they're doing to prepare and respond to COVID-19. This announcement of a COVID-19 case follows a press conference earlier this morning by our Shelby County Health Department colleagues announcing their first case. These two announcements represent the second and third cases of COVID-19 identified in our state. As mentioned last week, we've been expecting to identify cases in Tennessee and have been operating from our State Health Operations Center since early January. TDH is working very closely with the governor's office. As Governor Lee said last week, we will maintain transparency and continue to work closely with our medical community and other stakeholders to prepare and respond to this novel coronavirus. We want to encourage Tennesseans to maintain basic preparedness for themselves and their families. The tornadoes this week were a difficult reminder of the importance of personal preparedness. We're encouraging Tennesseans to follow the prevention measures mentioned today and to maintain perspective on this evolving situation. While the newness of coronavirus can be unsettling, we're learning more each day about the disease and understand that the majority of people infected have mild respiratory illness. At this time, we're working with CDC and with other state health departments to slow the spread of the virus in Tennessee and nationally. We're working with local health officials on these 3 distinct cases that have been announced over the past few days and have not recognized community spread in Tennessee at this time. However, we will continue to emphasize preparedness activities in anticipation of community spread if that happens. I want to thank our health departments in Nashville and the medical community, including our partners across the state who've been working tirelessly, working 7 days a week and actually well into the night last night to gather important information that helps us identify contacts and facilitates control measures. The Tennessee Department of Health Laboratory is providing testing capacity for the state for persons who are sick following consultation between public health and medical providers. We're communicating with the community medical providers across the state to provide the best guidance we can on care and testing for persons with respiratory disease, and it's important to remember that we are still seeing a high amount of seasonal flu activity. Persons with health concerns about COVID-19 who are ill should contact their medical providers. We encourage healthy people seeking general information to first go to the website at tn.gov/health or the Nashville website that was mentioned, and other trusted partner organizations like CDC and the World Health Organization. We're also working closely with the Tennessee Poison Control Center here in Nashville to answer questions from the public. The COVID-19 public information line number is 877-857-2945, and that resource is available to people who have general questions about what's happening with COVID-19. Again, I want to thank our Nashville Metro partners for their response and their work and the chance to share this update with you this morning. Thank you.
Thank you, John. Thank you, Dr. Dunn. So that concludes the comments. Now we'll open it up for just a couple of questions. We will have Dr. Battle, Chief Swan available if y'all want to talk about to schools. We also have Dr. Dunn as well as Dr. Wright and Rachel Franklin as it relates to our emergency response in lieu of the announcement today. I also have a news release that I'll be sharing with you all as well. So with that, maybe a couple of questions and then we'll...
I can tell you that's a great question regarding self-isolation or quarantine. Self-isolation is voluntary. Quarantine usually means something that might have a higher level of concern. So they could be used interchangeably, the terms, and I think it's meant to convey that patient is cooperative and wants to stay away from others, and she's at home. I'd leave it to you, Dr. Dunn, to answer the other question. Thank you.
Yeah, so the question was about community spread, and as Dr. Caldwell said, we learned about these cases late last evening, and a lot of work is being done to identify contacts. We're basing our the data that we have about laboratory confirmed cases is one source that we're going to use to assess whether or not we have community spread, and based on that information, we don't think there's community spread at this time.
We have probably time for one more, and then we can do one-on-ones.
I've got a question. Does she have other family members who live with her or any children who might be in her school?
Do we have that information? We could come to the podium. Just, I'd give your name and just answer. Thank you.
Rachel Franklin, Director of Communicable Disease and Emergency Preparedness here at the Health Department. We can confirm that this person does not have a child in Metro Public Schools.
Okay.
And they've all been self-isolated.
Yeah, may I go ahead, and then I'll be happy to give my thoughts.
Well, I think these are early days. I think every city in the country is determining the best policy. Right now, nothing is being canceled, but I do think that people are relying on following the doctor's good advice on common sense practices for limiting the spread. So, washing hands at the stations, going to public buildings, being very careful is where we are right now. There is no announcement about anything being canceled formally. No, all across the country, people are pulling back their own company's travels and their own conventions, to be sure. But in terms of anything officially being canceled, I'm not aware of anything major. Obviously, Nashville has some big events coming up right now. They are still scheduled. But again, we're here today to begin to follow the health department's very good, common sense, direct professional advice on, now that it is here, what we all need to double down and be sure that we're doing to limit whatever exposure or damage that we end up having from this.
Is this believed to be in the tornado cleanup area? Could that have played a role in transmission? And are you discouraging volunteers from going out right now?
No, absolutely not. As you all know, this has been expected. And it's not just this city and this state today, it's a lot of cities and states. It has nothing to do with the tornado. In the tornado response, though, we need human contact. And we're going to have it. And we're going to get back to work today busier than ever and for weeks ahead. Just in doing that, let's follow the public health department's common sense, and it's hard to remember. It's hard to remember. The elbow touch.
There you go, Mayor.
The elbow touch. The elbow touch. Washing your hands. And then be sure, everybody, to report yourself. If you have a concern that you might have it, then go get tested. Don't wait. These are, again, all common sense prescriptions, but has nothing to do with the tornado. It was headed here anyway. It's kind of surprising that it's taken this long, a little bit, frankly. But now that it's here, let's be sure to do what we can to mitigate the spread of this.
That's all. That's everything we have for right now. But y'all can do one-on-ones. We'll be able to answer those questions with one-on-ones. We have Chief Swan, Dr. Battle, Rachel Franklin, and Dr. Gil Wright are available, as well as Dr. Dunn from the state.
And I'll be giving a demonstration on how to wash your hands